I mean, just normal 30-year-olds that,
Medical issues?
no medical issues, none whatsoever.
The COVID-19 crisis surging.
It doesn't discriminate. Everyone is a target, both young and old, healthy and unhealthy.
I mean, it's real. I wish people understood that.
The coronavirus can spread anywhere.
He didn't have to die. Sorry. He didn't have to die.
Not even long-term care facilities are spared. People are tired of living in a COVID-19 world, but
The biggest thing is that, once you can't let your guard down, especially on this.
Anybody that you care about, anybody that you love, if you don't do just the simplest things, you are putting them in danger. Whether you've had it or not, it's not rocket science.
The stories of those who have recovered from COVID-19, those who have lost loved ones to the deadly virus, and the healthcare workers trying hard to protect you. Their united message you have to hear.
we go inside Indiana's COVID crisis. Welcome in to this WRTV special, Inside the COVID Crisis. I'm Mark Mullins.
And I'm Amanda Starantino. COVID-19 cases and deaths are surging, and healthcare experts have warned us to abandon in-person get-togethers and celebrations with extended family and friends during the holidays. Hospitals are filling up, and doctors are worried about the possibility of what's being called a twindemic when COVID-19 intersects with flu season, which could put further stress on hospitals and other healthcare facilities. There is hope, with at least a pair of COVID-19 vaccines already proving to be effective in preventing the deadly virus. But it could take time for those vaccines to get to a majority of the general population. And here's why the race for a vaccine is so important to Americans, especially Hoosiers. Take a look at this map of statewide deaths by day from the Indiana Department of Health. As you can see, deaths in Indiana are surging once again after we saw a significant dip in May, June, July, August, and part of September. Really, from October on, deaths have steadily increased in the state.
As a result, as we wait on the mass distribution of a vaccine, we are all being asked to wear masks and socially distance ourselves. And that's why you never see Amanda and I within 6 feet of each other in this studio. And it's not just deaths. Positive coronavirus cases in general are exploding among all age groups. You see, this isn't a virus only impacting the elderly or people who have pre-existing health conditions. We begin with the story of 30-year-old Charles Fields. With the help of IU Health in Indianapolis, Fields had to battle through a harrowing journey when he was diagnosed with coronavirus. He shares the frightening situation he had to go through and shows you what it's like to recover from COVID-19.
I just turned 30 before I got it. It was a week after. Was always outside fishing, walking. I always went to the gym. I mean, just normal 30-year-olds that, no medical issues, none whatsoever. It started off with just the simple, I was stuffy nose. That's all it was. And then as the days went by, my fever got higher. And then it got up to 104. So I got nervous about it, so I went to the emergency room. I didn't think I had the virus or anything, but I just thought it was just a real bad sinus infection or something. And then they took an x-ray of my lungs, seeing that there was stuff in there, but I don't think they didn't test me or anything. So, but really it was just, I couldn't sleep, and just the fever was the main thing. Well, the next day after I went to our town's emergency room. That night just got worse. I just noticed I was just so fatigued. That's what I felt after that day. And I was telling my girlfriend, it was just something ain't right. So she's like, well, we'll just take you to Bloomington. And then while we were going to Bloomington, that's when my shortness of breath started happening. So I knew something was going on, obviously. And then that's when they found out I had double pneumonia too. So, and then I remember the 2 days, they finally got my fever down. And then I felt great that one day, and then that night, it's like everything just went south. My breathing just cut off. I remember when I went to the ICU in Bloomington, they put a CPAP machine on me, and then they were saying, we're going to administer you some medication. And then it felt like maybe 10 minutes later, I was out, and then I woke up here. So 18 days later, I woke up here. Of course, I'm still fatigued, and my mind's all cloudy, and I kind of was wondering if I was ever actually going to get out, because I didn't know. I don't know, it was just lonely, because none of your family's there or anything. Life's short. You just don't know when it's what will happen. I didn't think that me just turning 30, I'd go down the road I just did. I mean, just take precautions. Yeah, you may not see it, or you may see just videos of it or whatever, but I mean, it's real. I wish people understood that, but not to live life in fear. I mean, I'm not trying to live my life in fear. I'm trying to go out and do what I used to do, but I take all the precautions I need to take.
COVID-19 has had a devastating impact on people who live and work in nursing homes. More than half of the state's deaths have come from long-term care facilities, and some are concerned about the impact this winter will have. WRTV Investigates Kara Kenny found some families who lost loved ones, as they're left wishing more could have been done to protect them from the virus.
More than 2,500 nursing home residents across the state of Indiana have died from COVID-19, including 18 here at Ben-Hur. These are the numbers from the state's database, but each one represents a loved one that a family member will no longer talk to.
This is the last thing that I make for my mom. I wanted her to have something beautiful and special for her at her funeral.
Mary Johnson has a little piece of her mom at home. Martha McCullough died May 16th at the age of 77 after developing COVID-19 at Ben-Hur, a nursing home and rehab facility in Crawfordsville. How much do you miss your mom?
Very much. It's rough. I promised my dad I'd take care of her before he passed away, and he just passed away in 2019. And then they closed us down, and I couldn't get in.
Nursing homes were closed to visitors during the early months of the pandemic. Mary was able to say goodbye to her mom in person at the hospital 2 days before she died.
It's a memory I'll have forever. She took her hand and she grabbed mine and she pulled it down to here and took her other hand and wrapped it around me. She knew I was there, and it's the first time from March.
Janice Ford didn't get that chance. She had to say goodbye to her brother Charles England over the phone as he lay dying at the hospital from COVID-19.
He told me he loved me, but it was almost, so light that I couldn't hardly hear him. He was so weak by that point.
Charles England also got COVID-19 at Ben-Hur and died May 22nd.
It's hard to know that he didn't have to die. Sorry. He didn't have to die.
Janice and Mary feel the nursing home didn't have adequate infection control procedures in place at the time. The Indiana Healthcare Association, which represents many Indiana nursing homes, says in the spring, facilities were not well equipped with N95 masks and other supplies.
I think what we're going to see is a lot of the tragic loss of life that occurred early on in the pandemic. And that was when the country was caught somewhat flat-footed, and prioritization of PPE and testing just wasn't with long-term care at that point.
It wasn't until July that the state started testing all nursing home workers for COVID-19. In August, the federal government sent antigen testing machines to Indiana nursing homes, allowing them to do frequent testing of residents and workers. And it wasn't until November the state sent in the National Guard to help nursing homes plagued with understaffing. Transparency was a problem too. For months at the start of the pandemic, WRTV Investigates requested data showing where people were dying in nursing homes, but the state told us no.
We don't have a cumulative list of every facility, all of their cases, and all of their deaths.
It wasn't until July they changed their mind.
We are going to report facility-specific COVID-19 data.
AARP Indiana was one of the groups that pushed hard for the state to release nursing home COVID-19 data broken down by facility. Information scarce at the start of the pandemic is now readily available on the state's website.
Definitely encouraged that we got there eventually. That definitely empowers folks to be able to look at the data themselves and help them make decisions.
AARP Indiana State Director Sarah Waddle is concerned about the impact winter will have on nursing homes.
There hasn't really been a comprehensive plan from the state to address virtual visitation, which is going to be absolutely needed. over these cold months.
Plus, the National Guard is expected to leave nursing homes on December 31st.
What happens when we don't have the National Guard in the facilities anymore, or the extra bodies?
WRTV Investigates requested on-camera interviews with Governor Eric Holcomb and the State Health Commissioner Chris Box to talk about long-term care, but no one responded to our request. American Senior Communities, which operates Ben-Hur, tells us they are testing 100% of residents in any facilities where there is reason to suspect a resident or staff member may be COVID-19 positive. ASC is also testing 100% of residents in facilities located in high-risk regions, even those with no known COVID-19 contact. All staff members are tested weekly at a minimum, with staff at some facilities tested twice weekly. As nursing home deaths continue to rise, a reflection of increased community spread, Janice Ford and Mary Johnson want you to know that each death is important.
These people are somebody's family, and people do love them. And they had families that they loved, and I don't know, how could you just throw away somebody?
Mary struggles with her own health issues and guilt over not being able to care for her mom.
It's the last thing I'll ever be able to make for her, but it's beautiful like she was.
Working for you, Kara Kenny, WRTV.
American Senior Communities started releasing COVID-19 data before the state required it. ASC also tells us, quote, "We are deeply saddened whenever a resident or staff member becomes infected, and we grieve for each resident who has passed away. As residents begin to recover, we remain steadfast in protecting and continuing to serve them." And the company points out they also do point of care POC machine testing at all facilities. POC testing began in September, and they are averaging more than 60,000 tests per month.
Finally, some relief may be on the way. 2 COVID-19 vaccines made by Pfizer and Moderna have been tested and have both shown to be about 95% effective in preventing the coronavirus. We've obtained Indiana's COVID-19 vaccine plan submitted to the CDC. It calls for healthcare workers and those who are at the greatest risk of death from the virus to be vaccinated first. Dr. Anthony Fauci says a vaccine may not be available to the general population until April, May, or June, but many people have questions, especially about the safety when it comes to the vaccine. I took that question to an expert.
What do you say to people who have concerns about the vaccine being made so quickly compared to other vaccines? What is the trustworthiness of this, and how do you convey that to people?
Mark, I think I'm glad you're asking that. I think it's really important for us to get this message out there. The speed of making the vaccine is just that. They've added a bunch of speed and amplified and sped up the process as far as making the vaccine. They have not skipped the safety steps. They still have to go through the trials and get through the FDA and show that it's safe and effective before the vaccine's approved. So none of that is being skipped, and it's really important for everybody to know that and know it will be safe when it's approved and out on the market.
We reached out and heard back from the Indiana Department of Health. They say whether you receive a COVID vaccine or not, that's protected personal information, meaning you can get vaccinated or choose not to, and it's up to you if you want to share that information with anyone or not. When we return, a candid conversation with a registered nurse putting her health on the line to protect you. She shares the daily hardships she's facing and what keeps her going in the fight against COVID.
It is the most difficult year our teachers have ever experienced.
And we are also talking with the people who make the decisions about your child's education during the pandemic. Next, a roundtable conversation with superintendents of some of the largest school districts in the area. You are watching a WRTV News special Inside the COVID Crisis. Through all of this, we cannot forget about the frontline healthcare workers who are devoting their lives to help us survive and recover from this pandemic. A registered nurse at IU Health gives us a glimpse of the frontline battle and what keeps her going throughout the pandemic.
I think the younger ones is harder. I'm going to get all teary-eyed. Just talking it out. Oh my goodness, give me just a second, I'm sorry. It's the ones that you don't expect to be affected by it. You know, where people are saying, oh, they don't have diabetes or hypertension. They're not a dialysis patient. My most memorable one was she was in her early 20s and just holding her hand and knowing that she was scared, and I'm doing everything I can, and the team, we're working as a team to keep her, you know, stable, and just watching her deteriorate, and no matter what we're doing, it's not making her any better. I mean, she ended up coming out of it okay. I mean, we did the right things and the right steps, but it was just emotional. Like, I'm a mother, and I'm looking at, you know, like my child, and it was difficult. You know, they're scared, they're isolated in their rooms, we don't have visitors, and just knowing that I am their person, you know, so I am their lifeline. And I mean, it feels great. I mean, to know that and know that I'm being a part of something that's great. You know, like at the end of this, like, we're all going to look back and, you know, it's like, yeah, we did that.
And from the front lines to the classroom, our kids in their schools have been hit hard by the pandemic. Many districts have changed from all virtual to hybrid, some to all in person, back to hybrid, back to all virtual. Education has constantly evolved this year. Our Kara Kenny met with several superintendents, and they explained what goes into their decision-making process and how they're planning for winter.
It has taken so much time and effort to get to this point, and now what do we have? Winter. You know, health officials are saying they're expecting a double whammy this winter when you've got COVID-19 and the flu, people heading indoors. Dr. Smith, how are you planning for that, or can you even plan for that?
Well, it's certainly challenging. You know, I remind people we deal with this every year. Flu, cleaning our buildings, shutting them areas off to do deep cleaning. We do that all the time. But with COVID-19, there's just so many uncertainties. And I just want to compliment all the health people. I know in Marion County, we work very closely with the Marion County Health Department and Dr. Kane and her group. I'm going to lean on the health professionals to give us guidance on what our next steps are going to be.
Well, I think one thing, as Dr. Smith alluded to, working very closely with Dr. Kane and the Marion County Health Department, they've set some parameters and guidelines. And so, you know, I am on the website daily checking to see where our rates are and how the numbers are moving and what that might mean. I think for us, we were able to make that investment in technology so that every single one of our students now has a device. The family needs Wi-Fi access. We've provided it so that if we need to shift the learning mode, we're able to do that. And we're able to do that in a nimble way.
We are very fortunate that a good thing that's happened because of the pandemic is that we have moved almost to one-to-one. Every family or every student who needed a device has one. Every family that did not have internet has it. And so we're able to take care of that so that we really do have an equitable educational environment. I would tell you one of the things we're trying to prepare for, but I'm starting to get a little bit nervous, and that is the lack of substitute teachers. We know that when we have to quarantine, or if somebody is sick or with the flu and COVID-19, I'm getting a little nervous on days where we have a large number of people who are ill, and the sub pool is very small.
We've been finding substitutes more and more difficult to find for several years, and this year is even harder to find substitutes to come into our buildings and help support and keep learning going. So we've absolutely found that. We found that we have to constantly communicate and remind people of what we're doing and why we're doing it.
Let's end on a positive note. Let's talk about some of the successes that you've had, or what is the one great thing that has come out of this pandemic?
For me, it's just that we've been able to sort of prove what's possible, right? We were put into this very challenging, impossible position. And yet, as you listen to all of us, we've all found ways to creatively, responsibly, and responsibly respond really quickly to this. And so I'm really proud that I think we've been able to demonstrate as public educators how flexible and agile we can be.
This is our year of reimagining education. Things are very different, but they're different in a way that we've been able to respond in a really quick amount of time. And so for us, we weren't one-on-one, and so now we're very close to it. But what we're doing now is to being able to deliver instruction remotely for families who choose. And so the great thing about that is that we have educational equity because nobody's left behind because of that.
We learned very quickly that we, like Dr. Flores said, just reimagining learning and teaching in school. We're making it happen.
There are things that we've been forced to learn that we're going to keep doing forever because we've come up with some great creative solutions that work and will endure beyond this pandemic. And our teachers are creative by nature, but their level of creativity to meet the needs, the incredibly diverse needs growing even further apart during this time, is just amazing what they're doing for our kids.
Next on Inside the COVID Crisis, a respiratory therapist is on the front lines of the coronavirus battle and helping a growing number of COVID patients. When we come back, you'll hear his important message for everyone. Welcome back to this WRTV News special, Inside the COVID Crisis. As we enter the holiday season and get closer to winter, it's easy to let our guard down with family and friends, but a respiratory therapist with IU Health has this message for you.
It is not over with. It's not close to being over with. And until we either develop a vaccine to get over it, we're not going to get over it. I think you can say that evidence as far as social distancing and wearing a mask and, just doing what you can to make yourself safe is not as effective as what they may say. I completely and wholeheartedly disagree. All you have to do is wear a mask, stay out of a crowded room, and be smart. You're not just protecting yourself, you're protecting everybody that you're around. Anybody that you care about, anybody that you love. If you don't do just the simplest things, you are putting them in danger. Whether you've had it or not, it's not rocket science.
Expert advice we just can't share enough. As we wait for mass distribution of a COVID vaccine, the way we can help stop the spread of coronavirus is by wearing our masks.
And by social distancing and not gathering in large crowds. From all of us at WRTV News, stay safe, Indiana.